So Kodi, what aspects of your patient's life do you feel you impact the most?
So the aspect of the patient's life that I feel I impact the most is changes towards diet and exercise. Most of my patients are willing to talk about their dietary lifestyle and their exercise more than anything else. Stress factors come up every once in a while. I feel some patients are more uncomfortable talking about that. Some are more comfortable. I never try to push my patient. I let them talk about what they want, but we mostly talk about diet and exercise and what they can do to better improve their blood pressure through that. How do your patients benefit from medication management?
Well, in addition to working with their health coach on their diet and physical activity, sometimes patients need more to get their blood pressure control. And that's where the medication management and working with their clinical pharmacist comes in. Medication management is sometimes just what patients need to really get their blood pressure well controlled and get them to goal. And the best part is we do it all over the phone, so patients don't have to go into their doctor's office to get their medications adjusted. We can do that just from looking at the blood pressure readings they send in to us through the program.
What feedback do you hear the most from a patient after making a successful medication change?
The best feedback is usually their excitement. They're excited to see that their blood pressure is getting controlled. A lot of times patients will have been on the same medications for years and years and not really see any results. All it takes is either increasing the dose or changing it to a more effective medication. And when patients do that and see the result and their blood pressure readings coming down, they're really excited about it. What's your favorite patient success story?
My favorite patient success story is one particular patient that came in with high blood pressure readings, very uncontrolled, and now he's under control. We've slowly progressed throughout our phone calls to get that control. Every time I call him, he has a success story about dietary changes, exercise changes, or even something new that he learned on how to control his diet. He knows what affects his blood pressure when he eats something specific or when he doesn't work out, or even his stress factors. He knows what kind of stressors affect his blood pressure. So every time we follow up, I think we have great conversations. He's kind of learning what's affecting his health. And so far, all we do is check in, follow up. His blood pressure is very controlled and he's excited to be where he's at. What's your favorite patient success story?
I think my favorite patient success story is a patient that came in who was very anxious about her blood pressure being uncontrolled and what could happen if her blood pressure remained as elevated as it was. So I talked to her, I let her know that through this program we're going to monitor her, we're going to work with her closely to do what we can to get her blood pressure better controlled and to kind of calm her anxiety around checking her blood pressure. I let her know that if she checked it and it was high, it was okay because we were here and we were going to work with her to get it better controlled. And now she's very well controlled also.